Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. We'll talk with experts on a wide range of topics, including nutrition, stress relief, sleep, mental health, etc.
And we'll dig into the issues that can cause fertility challenges, like PCOS, or early menopause, or cancer treatment.
So if you're curious about your fertility, whether you're ready to start a family,
or you're preserving your options for the future, let's dig in. In females, a violent disease also arises in the womb, and next to the stomach, this part is most sympathetically affected or most sympathetically affects the rest of the system.
Hysterical passion is the name, but various and several are its symptoms.
Fumigations, cataplasms, and compressions are ineffectual. The hysterical body should be treated with care. Hot baths, massages, exercise are the best prevention for such women's diseases.
One more. It probably sounds better in French, but I can't say it in the French. So here's the non-French translation. Where have they gone, the hysterics of yesteryear? Whose amazing women, the Anna O's and the Emmy Van N's? Where is there now to take up the place of the hysterical symptoms of long ago? We might answer that the despised hysterics of yesteryear have been replaced by the feminist radicals of today.
Ooh. And with that, you guessed it, we're talking about hysteria today.
Ooh, there's so much to cover. But yeah, we started season 1 with kind of a history episode, and we thought, let's do the same thing for season 2.
Yeah, take us back to our original first episode, do something historical, and man.
And now hysterical. It's good.
Yes. Historical, hysteria, be wildin'. Let me tell you, it's a lot.
I know, but I was reading stuff for this. I was thinking about how, like, at the Women's March, you see, like, people wearing all the T-shirts about, like, well-behaved women seldom make history. And I was like, that's right. All the hysterics totally make history. That's what we're reading about now.
I can't remember which one of the men said this throughout history, but it was, the symptoms were a tendency to cause trouble. Mm-hmm. And I was like, yep, I would be a hysterical woman.
Don't you want that one on a T-shirt?
Right? Tendency to cause trouble, hysterical woman.
So we're going to outline today, like, what is hysteria? We're going to go through the history. We're going to talk about the treatments because they're, like, fascinating and fun. But the reason that we're also talking about this is that there's so many, like, parallels and reasons that this is still something that we need to know. It's not even, like, ancient history, but there are a lot of echoes in the way that we look at issues that are quote unquote women's health issues today that still really go back to this whole concept that anytime there was a woman in society that was not behaving in a way that was expected of her, it was all bundled into this diagnosis of hysteria, which included all these medical symptoms as well as any sort of behavior adaptation that didn't fit in with the societal norm.
Exactly.
I'm sure I said this at some point in season 1 because it's one of my favorite quotes, but it's talking about, like, you know, history may not repeat, but it echoes. And it's true. It's like you get these concepts that just bounce back and forth through time. And sometimes you don't even realize where things came from. And that's what I think it's so cool to go back and look at something like hysteria historically and all the ways we still see these concepts today.
I had this article from, the Clinical Practice of Epidemiology and Mental Health. It was published in 2012 by Tosca et al. And it was great because it's a medical journal documenting the history of hysteria. And throughout, it was talking about the different theories from different physicians throughout history. And then you'd get a couple thousand years down the road and it'd be like, oh, and then this person was also ascribing to Hippocrates, and like a couple more thousand years. Oh, and now they are going back to Hippocrates. They're still using this. It's like, really? Like, okay.
I had the same article, and it's so fascinating to see that, like, you know, the DSM. So when the first DSM, which is like the kind of medical manual you would use to diagnose mental health conditions, when it came out in 1952, you didn't have hysteria as a condition, but then they added in 1968, which is also kind of fascinating, right? If you're like, so it's not there originally, but between the 50s and the 60s, wow, maybe there were some women that weren't behaving well. And so then it got added back in, and then it was removed for the DSM-3, which is in 1980 that it's removed. So it's like when I was born in 1978, people were still being medically coded and diagnosed with hysteria. This is not like only time of Hippocrates kind of stuff.
It is fair to say that we're going to be starting on a level of offense. Like, just get your eye roll muscles ready to go. And remember, we're taking like the way back machine all the way back to ancient Egypt and ancient Greece. And so hysteria, for the most part, has been seen as a quote unquote disease of the woman. And as we've mentioned before, medicine today, and definitely not back in the day, does not do a good job of working outside the gender binary. So when we're talking about women or female in this episode, we're referring to those who have or had in their lifetime had quote unquote female reproductive organs like uteruses, ovaries, fallopian tubes, vaginas, vulvas, and the like. And of course, we recognize that not all women possess these structures and not all people with these structures identify as women. But what is certain is we will be talking about the historic oppression of women as a quote unquote lesser sex. And I'm just going to say, and so I don't have to say it throughout the episode, just consider this whole time a big quote unquote.
Yeah, exactly. Well, and especially we'll talk about it when we get into Freud and stuff. Like when you start realizing the male hysteric, it's like, oh, well, let's talk about when would be the power differential cases when that would come out. So yes, if we're using these categorical terms of men and women, it's really primarily because we're talking about people who are not behaving in a way that the dominant society wants them to behave. And for the bulk of human history, the people who have not been the ones in charge of deciding what's appropriate have been women. And that's sort of where the people setting the rules, deciding what is hysteria, are those that have a power differential to the people that are experiencing these problems. And that's why we're talking about today still.
Yeah.
We fixed it, society, we're done. Yeah. So glad that there's none of this anymore.
We wish, right? Oh my gosh. Well, as we'll talk about throughout history, there's lots of different symptoms of hysteria.
Start with the definition, because I was trying to find this for the outline. I was like, gosh, how am I even going to define it? So what would you say if someone asked you to define hysteria?
It's like, I don't think it really has a set definition, because it literally is all encompassing of any random symptom that didn't have a quite obvious cause got lumped into this hysteria, or anything that physicians could not explain, especially when it came to women and women's reproductive organs. They're just like, it's hysteria. So common things, as I mentioned before, the tendency to cause trouble. So check, got that one. Anxiety, yes. Insomnia, I'm good there. Heaviness in the abdomen, loss of appetite for food, or eating too much, or having a loss of appetite for sex, or sexually forward behavior. It's just like any and all things that they could not explain.
And neurologic symptoms. That's the thing. So people that would faint, people that would have seizures. You know, again, this is before the time of a lot of diagnostic testing. So anyone that kind of had something strange going on, we'll go through all I love this one quote. I think it's from the same article that you mentioned. So hysteria is undoubtedly the first mental disorder attributed to women, accurately described in the second millennium BC, and until Freud considered an exclusively female disease. But over 4,000 years of history, the disease was considered from two perspectives, scientific and demonological. So you gotta love that's your binary, right? It's either we're going to attribute it because your womb is wandering around, there's this scientific cause, or, I guess it's demons. I
guess you're possessed. So sorry about that. Yeah.
Those are your two choices.
I also have that little passage highlighted in this article. Well, let's go all the way back to ancient Egypt. This is our first documented cases of talking about hysterical disorders, which they attributed to spontaneous movement of the uterus. Just up and walking around in there.
I know, but I mean, do you think about it? I mean, this is for a long time, even autopsy, looking at bodies, these were not okay things. You really didn't know what was going on. But you kind of understood that there was a difference, and that some people would give birth to a child. And so they had some sort of part inside that was helping them do that. And that seemed to be what was different. And so it's like, if they're acting in a bad way, it's probably that womb, as they called it back then, that was, out of position. So.
Yes. Also, in the time of Hippocrates, physicians and philosophers and the like scientists were not able to study the female body with cadavers or anything like that. So they got their information from midwives or from women that they knew, I guess, and they just kind of then translated it to however they saw fit. And I think I just read it in the book that I'm reading, the Vagina Bible, and she said it was like mansplaining from at its finest from the very beginning or something.
Well, yeah, like scientifically, a few different articles mentioned this. Like, remember, the female body was just considered an inferior male body. That it's like you didn't quite make it to develop all the important man parts, and so instead you have all these lady issues that come up, and most of them must be this like uterus/womb that's just like wandering all over the place. But in the Egyptian papyrus, I mean, the symptoms they describe again are very like epileptic. Like people would have these seizures, and the reason was, oh, I guess your womb is in the wrong place. So, do you want to say it or do you want me? What was the treatment that the Egyptians prescribed?
And this actually is seen throughout history too. It took a while to go away. So, if it's too high up, if the uterus is floating around near your lungs and causing problems, then you're going to want to place a malodorous or acrid substance near your nose and mouth, so then you can kind of push that uterus down because it does not like those smells.
Scare that uterus back away.
Scare it down.
Yeah.
But also to lure it back into the right place, you want to put pleasant smells down near the vulva and the vagina. Oppositely, if your uterus is lowered, then acrid substances should be near the vulva and vagina, and then you can smell the pleasant smells around nose or mouth. I don't know which one is better or worse. Like, would you rather like smell the acrid substances, or would you rather that on your vulva and vagina? I don't know.
And then I was thinking, as my friends and I exchanged holiday gifts and they were giving me this beautiful scented candle, I was like, oh, we still use our scents for relaxation, which I'll kind of like comes from this, which I had never even thought about. Like when you had Victorian ladies having a touch of the vapors and carried around their little sachet to smell to help revive them. That's all based on the same philosophy that you're trying to, get everything back in position with these. But yeah, it's fascinating. But, you look online, people are still selling vaginal potpourri, pessaries that you can stick up inside that is really not that, again, no more medical evidence for that than there is for back in the day, these kinds of theories.
I've heard of vaginal steaming recently, and that goes all the way back to ancient Egypt. They like literally held women over the fire to steam those substances up. So it's to this day.
And what I appreciate too is like you talked about the Greeks, like when you get into the Romans, then it's like how, society and science in particular, it's very hard to ever say we're wrong about anything, right? They like to just revise. So they're just kind of like, okay, maybe because now we've started understanding bodies a little better, maybe it's not that the uterus like moves all over the place. It looks like it's kind of fixed, but we've seen prolapses, so we think it stretches a little bit. So we think it's just like needing to be held in place a little bit better. And so the idea is that the best way to kind of like fix it right where it needs to be is, of course, to like tie that uterus down with a pregnancy. And that's when you kind of start getting into all the sex being related to it stuff that we had mentioned. Talk a little bit about your Serranus quick, because we mentioned him in our first historical episode as well, kind of also known sometimes as founder of modern OBGYN. So he was that quote that you read who kind of said, yeah, but maybe you need that little bit more self-care, like take a nice bath. Maybe you need to exercise.
Starting with ancient Greece first, there's a physician named Melampus, and he was called to the city of Argos by the ruler of the city, who apparently was having an issue with a group of virgins who are revolting.
As virgins tend to do, yeah.
As they do. So according to Melampus, these virgins refused to honor the phallus and then fled to the mountains. Obviously, that behavior was considered madness. So he then cured these women with hellebore, I think is how you say it, or hellebore, and urged them to join carnally with young, strong men. And according to him, they were cured and regained their wits. So that's kind of where we started. It really did start off on a very like sexual, get pregnant, get married, get pregnant kind of vibe.
And that's where you had that quote, right? That the uterus was an animal within an animal. You got to love that quote.
Oh, that was Plato in Timaeus, his work Timaeus. The uterus is sad and unfortunate when it does not join with the male and does not give rise to a new birth.
And that's part of the reason like we're still talking about all this stuff, because I mean, not like we're saying these things out loud anymore, but I think you look at so much of society's stigma and judgment right now, and especially when we move forward a little bit more in time and start bringing in the demonological aspect and sin and how like procreation is like the whole point of your life, basically. And if you're not procreating, that must mean that something is wrong with you at this like possessed level. I mean, it is pretty strange to think about that the whole basis of what you're supposed to do in life was really related to what's your uterus up to, and like how
Right.
can we make it do the things that society thinks it should be doing.
Right. And if you're not interested in a penis, then there's something wrong with you.
Right. Yeah, exactly.
Yes. And so back to Soranus, Greek physician who was actually practicing in Alexandria and Rome. So you get kind of that like crossover happening. So he wrote a treatise on women's diseases and he was considered the founder of scientific gynecology and obstetrics. So women's disorders arose from the toils of procreation. Their recovery is encouraged by sexual abstinence, actually, and perpetual virginity is a woman's ideal condition. So this is where he's like, actually, you're very fragile creatures, so you need to take hot baths and massages, in which, okay, I can get on board with those treatments. But
again, these are your binary options, right? You're
that's right.
like fragile and need a protection, or possessed by the devil, and that's why you're doing all this other stuff.
Yeah, and that actually comes into the Dark Ages as we move into the Dark Age and the Middle Ages, and then as we progress through with Christianity and the Renaissance and things, and Victorian era.
And it is a really interesting pivot, because if you go early on, this is really seen just as a disease, right? This is something that needs treatment. Like, it's not your fault that your uterus is moving all over the place. Like, how can we help you? But then once you bring in that aspect of religion and sin or even possession, like all of a sudden now, like people kind of need to be punished, because like obviously they've been making poor life choices if they are now having these like possessions brought upon them. And that's when you kind of move from more of this help taking care of you, you weak creature, into like, okay, how can we punish this sin away so that you will like go back to being a well-behaved, non-hysterical woman.
And then Thomas Aquinas, I think, also had something to say about it. He followed the Aristotelian concept of male superiority, and the inferiority is the consequence of sin. Eve took the apple, so she therefore must need to be punished by painful childbirth and the like. And if anything is going on with her, well, they didn't know the term psyche at the time, but hysteria, that was related to the original sin.
I like this quote from that same article. Like, what does this have to do with women's health? It is quite simple. If a physician cannot identify the cause of a disease, it means that it is procured by the devil. Those are your options. If we've tried the vapors and we haven't like fixed the room, and you've like had the sex and you're still feeling anxious or having low energy or wanting too much sex or no sex, then now we've got to really bring in that religious aspect.
Yes, and this brings up demonologic vision, which is where we start to put our toe into the idea of the woman witch.
So what time frame are we in now? So we've left behind Greece, we left behind the Middle Ages, where we were kind of starting to add in some of this stuff.
Late Middle Ages, I would say. Historical women are then subject to exorcism, the problem being demonic possession, and early Christianity exorcism was seen as a treatment up into the Middle Ages, but then it becomes a punishment as we go forward, as it starts to be equated with witchcraft and sorcery.
Yeah, because now it's like a choice. Now you're not just like possessed, unwittingly. Now you're like probably somehow bringing this upon yourself.
Right. And so a big thing happened in 1486, and a lot of people might have heard this before, if you've ever heard of the Hammer of the Witches or the Malleus Maleficarum. And this was a document that was created by Heinrich Kramer and Jacob Sprenger, which was essentially just like a hunting guide for witches.
Like your birdwatch field guide, but it's like
That's
your
right,
guide to the common witches.
That's right. And this article that we keep mentioning, it was just so good.
Yeah, it was.
It was really like thorough and good, but it brought up that there is actually in the title itself of Malleus Maleficarum, the targeting of women is actually identified in the title, because Maleficarum is equated to witch, where Maleficorum is related to wizards, so AKA evil origins from women.
Well, we forgot to even mention that, like, where does the term hysteria come from? So hystera is uterus in Greek. And so the whole idea is, even the term itself is that when we're talking about it in the Egyptian text, they don't use the term hysteria. It's just the symptoms described or what are later going to be described. And it's related to this womb moving around. But then it is in the Greek time frame that they go ahead and just decide to call it hysteria to make it very clear that the uterus is the root of all these evil problems.
Descriptions of witches during this time are very comparable to the language used in pathological medical manuals at the time. So this is a quote from that article. The devil is a great expert of human nature and may interfere most effectively with a person susceptible to melancholy or hysteria.
And the thing is, like we've mentioned, as we're continuing to move through history, we're only like midway through now. What you see is this gradual shift in terms of where are the symptoms originating? Like, are they originating from the uterus? And then it's like, well, more it's possession. And then we're going to shift eventually into it's in the brain, but it's still the same concept that we see now. It's a bucket list to put any sort of unexplained symptom or feeling to be able to just basically say, I guess we don't have to treat it because it's just a thing that happens because you have lady parts.
Exactly. And the most affected individuals, they were still considered to be the same thing that Hippocrates and ancient Greeks considered the most susceptible to hysteria, were women who are elderly, widowed, or single, or virgins, or sad.
Oh.
If they are mourning in any way, then they were melancholic when mourning. It's like, no, dude, she's sad.
And although we don't use the term hysteria as medical diagnosis, where's another time that we still talk about mass hysterias. You'll still have cases, and they tend to be in groups of often young women with a power differential. There's an outbreak in a factory where a bunch of women were fainting and having symptoms, and they thought it was a toxic thing, and they closed it down, and they never found a cause. And the idea was, I think it was all in people's heads, and it just kind of spread. And so, we still can see unexplained conditions, and they tend to arise more likely in a situation where people do not have power in any other way. And the fact that there's a physical symptom, there's an illness, there's something going on, that might be the only way people have to revolt, And that's what you see in all these different historical examples too.
And it's demonstrated even in today's pop culture. So I'm thinking right now of an episode of House. There's an episode where he's on a plane, and there is a gentleman who is getting very ill with a very mysterious, they can't figure out what's going on with him. And then people in the back of the plane start getting heads up that there's something happening. And then they start to develop the same symptoms. And so at the end, he's like, oh, this guy has the bends, but everybody else is hysterical kind of thing.
Yeah.
So, yeah.
When I was thinking about it, I just saw Avatar. I don't know if you've seen it yet, the latest one.
I have not.
It's long, but it's good. But like one of the characters in it basically has like symptoms of epilepsy, and they kind of have the two different sides of the scientists saying, we think she has epilepsy, and the other ones be like, no, it's because she's communing with nature and the spirit, and that's why she's having these fits, and nobody quite knows what to do with her because she doesn't fit into what the Na'vi are supposed to be doing. So, I mean, this is something that you see still in many different ways, even in outer space fantasies by James Cameron. As so many things are.
Or, as represented by Hugh Laurie.
Yes.
Since we've touched on witches, I think we should get into the period of what you've probably heard of before is Salem, Massachusetts.
Yeah.
So this was, as we were just talking about, an outburst of hysteria. But interestingly, the hysteria was causing these affected girls to accuse people of witchcraft. So it's interesting that you have both the witchcraft and the hysteria, but they're working against each other. And basically, a group of young girls started accusing people of witchcraft after they had some psychosomatic, we're not really sure, type of symptoms. And it just was a spiral into a mass hysteria.
Mm-hmm.
And so within Salem, Massachusetts, I believe there was 19 people hanged as quote unquote witches. And of the accused, over 100 were detained. So it was a big thing.
And part of that too is this is also, some people saw at the time as just evidence of like modern society that hysteria has been well seen in Europe for a long time, and now here we are in the colonies, and we're even starting to see hysteria. The idea was that it was maybe modern life is too taxing again for these weak females, right? And so this is again this symptom of things. And I mean, it's fascinating because you can look at it from so many different levels.
And it was almost a source of pride, oh, we're starting to get hysterical here. So that must mean that we're getting more modern.
Mm-hmm. And I want to jump ahead a little bit to the Victorian area too, because this is when you really get into the really fun treatments.
Yes.
First of all, the late 1700s, 1800s, when they have the whole idea of Franz Mesmer with this whole idea of animal magnetism and mesmerism, where you could use the energy of your hands to then move things around in the fluid in the body. And what's cool about this, and because you talk about this in treatment today too, why do we do things if we don't know why they work, but they do seem to work? They think later that he really was someone who was very good early on at hypnosis, that you're talking people and you're kind of using the mind in a way that might cure symptoms. You're not actually rebalancing the magnets in your body. But people had results from that. And again, that we see that in treatments even nowadays. We may not know exactly why something works, but if it's helping the individual person and it's not quite the same as punishing them as a witch, then maybe it's not worth completely discounting.
And I didn't look this up, but it makes me curious now that I hear animal magnetism again. Nowadays, you hear that and you think of like a man who is like hypersexual and like,
maybe Franz Mesmer was. I don't know when they used this tone for him, but mesmerism was a big thing. So
was it maybe because like the sexuality was a big part of it or something? I don't know. But I mean, it's just so interesting that that term is now something that's used as like a good thing.
Yes, and you had your smelling salts and you had all your other things that women in like the 18 and early 1900s would be carrying around to help them when they would be overcome by these symptoms. And so
the swoon.
Yeah, the swoon. And I don't think these women were actively thinking like, oh, I've got to smell nice odors because my uterus must be too low. But it was more just you had this whole societal thing that when one is feeling low energy, that's when you needed to do these things for self-care, have these nice scents. I think they mostly mentioned those smelling salts as being more in the mint and floral, not so much I don't hear about people carrying around little bags of trash to smell for bad odors. But
yeah, no. But, it definitely like that shortness of breath and that feeling lightheaded could not be related to, like corsets and standing straight up for hours on end.
I think it's the demonic possession. I think that's probably more likely. But we do see from lots of different areas that you have this longstanding belief that sex is somehow involved. And around the same time, too, is when Freud gets involved. And so, that's when you start realizing that that in some way having these like sexual release, which starts off as like pelvic massage that providers would perform. And then eventually you get into vibrators and water cannons and all kinds of interesting stuff to also treat these symptoms. That's all developing around the same time frame too.
Yes, we knew Freud had to get in there at some point.
What's really interesting about Freud is that not only does he open it up for it's no longer something that exists only in women, he talks about having a case of hysteria himself where he is worried about things and not feeling well because he flips it all around. So he's now saying that it's not that hysteria is the cause of these symptoms, but that you are having all your Freudian stuff, right? You have your lack of all your evolution, that you're realizing you don't have a penis and that's making you really sad and hate yourself.
Yes. Hatred of one parent, but like want to marry the other parent.
Yeah. So all that stuff is what's happening and that's what's causing you to have these symptoms of hysteria. And so it's like your messed up sexual longings are what's causing the symptoms as opposed to your symptoms are being caused because of these. So he flips it around a little bit, but the end result is not all that different in terms of what you need for treatment.
So first off, before we had vibrators, let's talk about that because in this like Victorian era, they started to use the hysterical paroxysm as a treatment for hysteria. And what was a hysterical paroxysm, Anne?
Well, it sure sounds like it was an orgasm, Ruby, but we don't know if, this is the myth.
It sure was an orgasm, yes. But if you're thinking like of this in a sexual way, like as the doctor treating it, no, it was like you came in, you went in the stirrups, there was like a little drape.
Yeah, there's some pretty amazing diagrams from
there
that.
Are.
We'll have to try and link to some of those. So.
But it was very much manual. And in fact, one of the physicians that was popular, I can see why, at the time for this kind of treatment was referring back to some things that happened with the midwives in ancient Greece too. So again, it's coming back through. But over through the time in the Middle Ages, like we're not going to do any kind of treatment that requires touching. So now we're here and we're helping women out manually. But then what just killed me was the doctors were starting to complain. It was hard. It was really hard work. You were getting like tired and getting carpal tunnel.
That could probably cause male hysteria if you're getting all worn out.
And it was just so difficult. It's like, who would have thought. It was so difficult to reach a hysterical paroxysm. So one of these doctors thought, okay, well, how can we make this easier? And that hence was the birth of the vibrator. The vibrator just made things so much easier for physicians. They were able to treat so many more people in the day. And I don't even want to know what happened in between patients because that they only had one. I don't know. But this also became one of the very first electronic devices. So within the first 5 or 10 electronic devices before the vacuum cleaner is the vibrator.
I love that stat.
And it was used as a health device. And that's how women kind of on the sly got away with having a vibrator in Victorian era. And because they were able to say it was like a medical device. And it wasn't until the 1920s when pornographic films came out and they started using vibrators within these films that society was like, oh, wait a second. That isn't right. And so then they were banned. And now this is where I have the very interesting tie into modern day. Did you know that in Alabama, it is still illegal to sell sex toys?
Any type?
Yes. Yes,
yeah, well,
it's in their obscenity laws, and I accessed my contacts. So she looked this law up for me because I was like, is this still in the books?
Yeah.
Because there was actually a Seattle Times article in 2007 because somebody was challenging this law. And unfortunately, they did not win. So it is still in place, and it is still a statute. However, there are loopholes.
Can you buy a personal massager? Because my neck is sore and I think I really need a massager.
Exactly. So it does not punish people for possession. So you can go to your neighboring state and get a vibrator and bring it back with you. That's fine. But if you want to buy your vibrator, your sex toy within Alabama, you need to have a medical, law enforcement, or educational purpose, which, okay, I can see the educational and the medical, but law enforcement? Okay. So so that's the loophole. So I don't know how that works, or if you have to walk into a store and be like, I need to have a hysterical paroxysm or something. I'm not really sure.
So if you need to buy a vibrator, you probably aren't looking for the Made in Alabama sticker. That's really not that important to you.
No. And I don't know about shipping. These days you can order online very discreetly. So I don't know how that works, but I just found that very fascinating that that kind of law is still on the books today.
Wow. I feel like I need the little, the more you know, little
totally.
icon and ding at the end. But
so interesting.
Yeah, but I mean, going back to favorite quotes from the beginning of all this, I'm sure I said this at one point in season 1 too, but there's a Faulkner quote where it's the past isn't dead, it's not even past. And it's true. It's these things are not gone. We still have all these beliefs, and that's why we're talking about this. We still see depression is twice as common in women. Migraines are 3 times as common. We have higher rates of disability and chronic pain. All these things that probably would have been just attributed to hysteria in the past, we still don't really research them as much as we should. And we see underdiagnosis still. We see that cardiac disease is much less likely to be diagnosed because symptoms are quote unquote atypical, which just means symptoms may not line up to the original research studies who were all white men. We have an episode coming up where we're going to talk about neurodiversity. You see this understanding of diagnoses of autism in girls because they are atypical. And so they were not diagnosed at the same rates when we had our original criteria come up. So this is something that's still happening in many different areas of medicine nowadays. You don't just undo 4,000 years of history and repression. A recent study that was carried out at Yale found that many women hesitated to seek care for heart attack symptoms because they were worried they'd be thought of as hypochondriacs. It's well, I don't want to make as fast my symptoms. They're not lining up with what I see in the movies. I'm not clenching my left shoulder and getting all sweaty, so it can't actually be a heart attack. I mean, we see all these areas, and what's really hard is that women are more likely to be told that conditions are emotionally caused or psychosomatic and that it's all in their head, but they're also often dismissed because health concerns are then just brushed off as still being related to the uterus.
Yes.
People will be like, well, that's probably just a symptom of menstruation, and that's why you're having, depression and concerns and all the stuff around your period. And Also, on the flip side, we're still not doing enough research on symptoms that do relate to having a uterus, that we're not treating endometriosis and fibroids and PCOS the way that we should. So, all of this stuff is still very present in many of the limits of medicine today.
Yeah. And even today, if somebody comes in for a menstrual related issues, bleeding or pain, cramping, anything like that, it's often just brushed aside. Well, it's like, well, that's just your period kind of thing. So
you would definitely be hysterical. You're taken to bed because you're feeling weak and woozy, and you might have, all of these physical symptoms throughout the years. You can kind of look back and check all the things that were probably happening that people just got put into that diagnosis of hysteria, and therefore we don't have to worry about it. There's so much that we have not understood and still don't understand because we're not spending the research to conditions that might be a little bit different in one population than the other. And of course, the intersectionality of all of this too, right? If we're talking about women, all of these things are also more pronounced in women of color, trans women, disabled women. All of these are even less likely to be treated appropriately by the medical system.
Oh, yes. If you were a lesbian any time in the last 4,000 years, you absolutely were hysterical because you did not, honor the phallus.
Right. That's another good t-shirt too. I do not honor the phallus.
TM.
Oh, curse this not being our holiday episode, but maybe by next year.
You need sweatpants that say that. Amazing.
And the other thing that I thought was really fascinating this time frame too is that's when they start promoting the rest cure. Did you read about this too?
Yes.
Oh my gosh. It's one of those things that like when you first look at it, you're like, okay, it's just a little bit out of the Serenus vibe. Like you should just take it easy and take care of yourself. But then when you like read in detail what they were actually doing, it's like you're being confined to bed, everything is controlled. You're not even allowed to write or sew or, exert your mind. Like you're really just this delicate flower that has to like lay around, ideally in the countryside with fresh air and everything done for you until you can regain your strength.
Yeah. And we're not even going to get into this part, but of course, hysteria has its hands in psychology and psychiatry. And so adjacent to this is all that's happening with mental health treatments. And you then kind of go off into lobotomies and things like that.
Yes. If the rest cure didn't fix you, you'd get institutionalized. You'd have some forced rest instead of just like your husband keeping you at home under rest.
Right.
Silas Weir Mitchell is kind of the founder of the rest cure. Did you see what his book is called?
No, I didn't.
So his book was published in 1884 and it's called Fat and Blood. Because in his knowledge, most women with hysteria were too thin and anemic. And so again, they had to be removed from their environment. They had to just like lay around and do nothing until they could build back up their fat and their blood.
Was this also the one, there was somebody in there that was saying that women who are slender and weak were more prone to hysteria, but if men were prone to hysteria, it was because they were lazy.
Yes, and that's part of it. That if you're a woman with hysteria, you need the rest cure, but if you're a man, you need to go do vigorous physical exercise because that's going to be the opposite cure. The American writer Charlotte Perkins Gilman was put on the rest cure and found it so harrowing. She wrote this psychological horror story called The Yellow Wallpaper. We have to link to it because it's like this slow psychological unraveling and it's written by the perspective of a woman on the rest cure who's trapped upstairs staring at this wallpaper and basically slowly, is she losing her mind or are forces against her? But it definitely gives you that claustrophobic sense of what it would have been like in that time when your whole life was controlled really by the men in power around you. And again, if you're not behaving up to the norms of society, then this was the way that you would be quote unquote treated as a more gentle way as opposed to the witch's punishment that we're trying to move away from because now we're a more enlightened society.
As I was researching that, I came across, I'm like, okay, to be read pile.
Yeah, it's a good one.
This actually brings up, because, it was a female author. Mm-hmm. We've been talking a lot about male physicians and male scientists, but it is important to mention that there were women along the way that were purporting hysteria and supporting the concept of hysteria. So Trotula de Ruggiero from Salerno in 11th century, she could never actually be a physician, but was considered to be the first female doctor in Christian Europe, and was an expert on women's diseases and disorders. But she also recognized that women were more vulnerable than men to things because of their gynecologic diseases and fragility, basically.
And honestly, if you're just looking at it from a strictly level of the things that what people would be observing before they had any other awareness of the body, it'd be like, oh, you're like leaking your body fluids. That does seem like you're probably losing your humors somehow.
Well, definitely those humors get out of control. But yeah, so she followed the teachings of Hippocrates, and she gave advice on how to work with your sexual desires. But this is what I really loved, because it wasn't like supporting your sexual desires or anything, or she recognized that having sex was going to help with your hysteria. But although it was the cause of the illness, she recommended a sedative to deal with your sexual feelings and just go to sleep.
Well, and some of that was tied into, again, the whole sex concepts too, and sin, and really just like, yes, maybe people might have these desires, but like if doing them is going to then put you out of the eyes of God, probably better to just suppress anything and take a nap.
Yes. And the other woman I wanted to bring up was Hildegard de Bingen. And she talked about that men with melancholy were ugly and perverse, and melancholic women were slender, minute, and unable to fix a thought.
Unable to fix a thought. Well, the men part is very interesting because, I mean, back where we were before when we were talking about post-Freud and all this stuff, the other thing that's fascinating once we kind of accept that maybe others can have hysteria is you suddenly have these two major world wars. And so that's for the first time that you start seeing widespread diagnosis of hysteria in men, because you have soldiers who will be on the battlefield and suddenly have like paralysis of an arm for no medical reason. They'll be taken off the field. And so all of a sudden you have hysteria that they're trying to figure out what's going on. And that's kind of when you bring in a little bit more of this fact that, yes, you can have physical symptoms in your body that may actually arise more from causes in the mind. And it's maybe a little bit more socially acceptable to be having, battlefield trauma where now I can't move my arm and that's why I have to leave. That's different than you're not being brave or you're leaving the front for another reason. And so you start having all this research now into neurotic illness and Western societies, especially between World War I and World War II. Mm-hmm. But then by the time you get into World War II, now there's been a whole lot of development in terms of understanding mental health, diagnosing people with post-traumatic stress or anxiety, depression. And so you don't see people being diagnosed with hysteria anymore. Now you kind of see this nice inverse curve where you have people being diagnosed with neurosis of anxiety and battlefield issues. But it's fascinating that there's that brief window when we're like, oh, I guess men can have hysteria too.
That's what it took to flip the switch. And then from 1949 to 1978, there was like a 2/3 decline in admissions to psychiatric facilities for hysteria. And then the sharpest decline started around 1971. 1971, people, that wasn't that long ago. Mm-hmm. And similar trends in Greece at that same time. So this is when things started to kind of slow down in terms of the diagnosis, and we are choosing other diagnoses for similar symptoms.
But again, it's not all that different because we don't know what's going on in the brain either, right? At this time, we're like, we don't know exactly what signals through the brain are causing this, but we know it's coming from the brain as opposed to it's coming from your uterus, but it's still something that we don't know exactly why, and it's causing this like wide bucket of physical symptoms.
Right. And this is all leading to 1980, which was when the DSM-3, so that is the Diagnostic and Statistical Manual. It's like the big book of psychological disorders. In 1980, that's when hysterical neuroses were deleted from the DSM-3 in 1980.
And that's kind of to pivot into, as we wrap this up, I mean, that's why we talk about it now. Like, people can't just check that bucket anymore and say like, oh, symptoms are due to hysteria. And that's allowed more research and all these other things, which were always there from the beginning. I found this fascinating. We know that multiple sclerosis is about 3 to 4 times more common in women than men. But until the 1920s, men were diagnosed with MS more commonly than women. And that's because back then, there are no MRIs. There's not a way to diagnose. So you were diagnosing just based on symptoms. And so if you were a woman and you reported those symptoms, you had hysteria. And if you were a man and reported them, maybe they would say that you have MS. And so we're diagnosing other things that can cause these. And we're just now starting to look at that. Women and girls were excluded from clinical trials for most studying conditions until 1990. That means that if you're not doing the research, you're not going to necessarily see differences that might be there.
It's fascinating, but it is good to take this look and remember how we got here and how things have changed, but sometimes they haven't changed as much as you think they have.
Definitely. And even just thinking about where the word comes from, right? Like, and like, where do we still use the term hysterical? Like, we can talk about it when someone's like distraught, or we're like, oh, it was so funny, I was hysterical. Like, again, right, you're like, it's something that's just like, wow, out of control, like not applicable for the situation, not responding in the way that I expected I would respond. And that's what too often all of these conditions were brushed off as. And we hope that this little window into the history of hysteria gives you an idea. And we will definitely post, if you want to read these articles yourself. Highly recommend reading The Yellow Wallpaper. Nice, creepy, very gives you a sense of what it must have been like back in the day. And we got a lot of interesting stuff to cover this year as we look at more hysterical women.
Don't forget your smelling salts.
Yeah. Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review The Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.